Okay, good afternoon, good morning, good evening, whoever you are, wherever you are. This is Dr. Patrick Lockwood coming back to you, not live again. And the reason's very simple. I've just taken to recording without going live because it seems like there's so much feedback and the equipment's not so good that I need to get some more money. Maybe people would donate in order to get better hardware. So thank you all for being patient with me as I've struggled with technology and for being supportive of what I do here on YouTube, despite the fact that sometimes my episodes have been not so quality. So hopefully today will be a little bit more quality. So what I intend to do today is something new and different. So I've done a couple of multi-part series before, especially the one on adaptive group identification, which I highly recommend you go check out. It's a concept that I designed and created as part of my book, The Fear Problem. It's worth reading. The book is also worth reading. Please get it on Amazon, etc., etc. So I want to do that again. I want to do another multi-part series again because what I've noticed is there are a lot of people who are very confused about drug use, drug abuse, and addiction. And I think because of, circumstances like the opioid crisis or epidemic and the never-ending death rate from alcohol and issues and smoking issues, tobacco issues, I think we need some better education in order to, maybe try and combat the problem at the system level. And what do I mean by system? I mean the family systems level. So I am titling my series the Family Addiction and Recovery Series, the FAR series. And I hope to go far with this series because it seems like an important topic that very few people actually understand. Very few people actually understand the role of families in addiction and in recovery. So although there are some books that were popularized in the 80s, etc., not much has been done in the last 20 years, unfortunately, in the way of research on addiction, systems theory, and recovery. So I want to try and get that dialogue going with this, what I hope to be comprehensive series on family addiction and recovery. So first, let me tell you a little bit about what my rationale is for doing this. I'll expand a little bit more. And then I'm going to do just the rest of this episode focused on just making sure terms are perfectly clearly defined so that anyone who watches this series from beginning to end knows exactly to what I'm referring when I say different words. Because again, there's a lot of conceptual confusion, and I want to either debunk or clarify things as I go along here. So please take this episode very seriously because the definitions I'm working with are very, very important, and I think they are the most up-to-date way of looking at the problem of drug use in society. So, first, the rationale. So, the main problem is obviously mortality. Loss of life is horrendous, Tens of thousands of people die every year to opioids, and that's terrible. Society loses about $740 billion a year, according to the National Institute of Drug Abuse, due to medical issues, due to insurance issues, due to costs to work. There's a huge burnout cost. Most people who are burnt out at work are using drugs to manage. So there's all these different societal costs in terms of loss of life, in terms of money, and the billions, hundreds of billions every year. And that should be unacceptable to anyone with any common sense. So that's the first driving motivation for this. The second driving motivation for this 6-part series on addiction is most family members that I've ever worked with, talked to, people in my personal life, everyone I've ever talked to about this, most family members have no clue what addiction actually is. And they have no clue the ins and outs of addiction and how to manage their loved ones who are struggling with addiction. And I use the word manage intentionally. The other problem is even professionals have just a pathetic understanding of addiction. I have a physician friend who always quotes a statistic about how poorly medical professionals are trained in addiction. Some have almost no training whatsoever, and for years that's been the case for most medical professionals. So everyone in the professional world and in the layperson world has been woefully uneducated about this problem, this diagnostic entity etc. And the other reason I'm doing this is because a lot of conceptual confusion exists in movies, in news media, and among professionals. So in movies, you'll hear people talking about addicts or drug abusers when they might mean something different, or they're mistakenly identifying people with the wrong label, getting the labels correctly despite the fact that many woke people are not fans of labels. Allows us to operate more efficiently and allows us to, let's say, deal with problems effectively. So woke people have no problem talking about racism and destroying that label, but they won't talk about medical and mental health issues. So we need to use the correct label to identify and deal with the problem correctly. And another reason I'm doing this talk is because systems theories, much like families in addiction treatment, go neglected. And this is a problem because much of the research that comes out nowadays for the last 20 years shows that when family is involved in treatment, especially rehab, it actually produces better outcomes for the identified patient in terms of sustained sobriety. So why wouldn't we have family more involved in treatment? That makes no sense to me. And why aren't families more involved? Well, it's real simple. Families are not more involved in treatment because of shame and stigma. Families are not more involved in treatment because of a lack of information and awareness of what addiction actually is. And families are not involved because they are afraid to mess up whatever's going on with their loved one while they're in treatment. So fear, stigma, and ignorance are the three common reasons why family members are not involved. Families need to be intimately involved in their loved one's treatment, whether it's an adolescent or a young adult or an older adult. Everyone needs a community and a system, and they need a healthy system in order to function, thrive, and survive. So, let's talk about how this series is going to break down, because I think I want to make sure I'm doing this in a comprehensive way. And after listening to this episode, please leave me comments and feedback about what other topics I might need to discuss. I can make this a longer series if you want, but I want to stop at 6 for now because I want to make sure I'm not, destroying anyone's attention about the topic. So the first episode is today's episode where we talk about the definitions and creating a roadmap for the next few episodes. The second episode will be focused only on the etiology of addiction, and I'm going to try and explain how someone develops an addiction disorder in the most plain spoken English that I possibly can muster. It's very complex. There are a number of important factors like genetics, learning theory, social modeling, peer influences, so many different neurochemistry that I'm going to try and do my best to break down into simple, plain English. Because what I've found is that when family members, loved ones, etc., understand exactly what addiction is, it's so much easier to have compassion, but it's also so much easier to have the appropriate kind of boundaries and interact more appropriately for that person's needs, for that addict person's needs. The third episode will be focused pretty much only on boundaries and the problem of triangles in family systems theory, and the implications of poor boundaries or faulty boundaries and triangles for people who are struggling with addiction. The fourth episode will be a regurgitation of the family roles concept and the implications for knowing your role. And even though it's not a very well-researched concept, I find that's a very kind of simple and easy way to understand how different family members of different kinds participate or hinder a person's recovery process in addiction. Finally, or not finally, number 5, the fifth episode will be handling relapses, because there's a lot of stigma, confusion, shame, fear around relapses. People don't quite understand how relapse fits into the picture for people struggling with addiction and substance abuse issues. And then finally, I'm going to do a video on the process addictions and what we consider process compulsions. And there's a lot of misinformation and bad science around the process addiction, so I want to try and clear that up in, again, simple, plain-spoken English. Now, before I continue on with definitions, I would like to let everyone know that I already have a video on addiction that explains what it is. So some of that will be rehashed in my etiology video, my second video. There also are a couple of videos I've made on process like addiction. So I did a video on porn already that you can watch. Please watch them. Let me know if I'm on the right path there. But I've already done some videos, so go check them out, okay? So far we've done the overview. Now let's talk about definitions to kind of wrap up this first episode. Again, I want to try and do this in simple, plain spoken English, and I want to do this in a way that's not only evidence-based, research-based, but also simple to understand so that you actually know with certainty what you're addressing whenever you're addressing these concepts in future talks of mine, when people talk about them in the media, etc., etc. So, what is addiction? What is this exactly? I'm sure many of you may typically think of like a homeless person who is a junkie, in quotes, or some kind of thug or whatever, but the truth of the matter is there is no consistent or reliable stereotype of a person who struggles with addiction. And this is because we really don't know what kind of behavior we're describing when we talk about addiction. There's a lot of myths and misconceptions, and people don't even know where that word junkie comes from. So, for instance, my understanding of the word junkie is what happened a long, long time ago. I think it's the teens and 20s and 30s, is that in the earlier part of the 20th century, people who were struggling with heroin use disorder used to search through refuse bins and trash bins outside of houses for junk that they could turn in to make money so that they could, buy their drugs. So they would look for cans and metals and etc. in order to pay for their drug habits. So they were called junkies back in the day. Most people don't really know that kind of stuff, and most people have no clue what addiction actually is. So I want to try and get that cleared up. I have treated people who most of you would call addicts, or who we would say have an addiction disorder, from every socioeconomic status, every age, every ethnicity, every racial group, every sexual orientation, every kind of person, from millionaires down to broke people, from all of them. Every person struggles with addiction. It's the most unbiased disease on the planet, in my opinion. So let's talk about some common definitions based upon the work of authors like George Koob from the NIDA and the DSM-5. So let's differentiate a three-part model of substance use behavior. And the three-part model I tend to use when I'm educating family members is substance use, substance abuse, and addiction. So typically, professionals say use, abuse, and dependence, but I find that paradigm unhelpful from the point of view of evolutionary psychology and affective neuroscience, which I'll discuss a little bit later when I talk about addiction. So I get rid of the word dependence because that's more of a diagnostic issue, less of a practical or pragmatic issue. Also, some people also add the concept of experimentation in the paradigm, so they have experimentation, use, abuse, and addiction. And I also think that's a waste of time. And the reason is very simple. If you understand what an experiment actually is, there is no experimentation, period. An experiment is a one-time scenario where you look at a variable or a set of variables, you try and control for them in a systematic way, and you see the outcome in that one instance. So there's no experimentation, period, with drug use. You experiment one day, one time, and that's it. The first time you smoke weed, the first time you drink alcohol or smoke a cigarette, the experiment is then over. Either you liked it after it burned your throat or you coughed, or you didn't like the way it made you feel psychologically and physically. It's that simple, and the experiment is now over. No such thing as multiple experiments in this particular paradigm. The experiment is over. So experimentation is not a phase. It's a one-time instance that the vast majority of people, in the US at least, in many Western countries, go through with a substance of abuse. So the model I'm using is use, abuse, and addiction. But before I get into that model, let's just talk about the DSM-5. So the Diagnostic and Statistical Manual of the American Psychiatric Association, 5th edition, was published in 2013, and there are basically 11 substance use disorder criteria. And there's different levels of severity. There's 2 or more symptoms for a mild substance use disorder, 4 or more symptoms for a moderate substance use disorder, and 6 or more symptoms for a severe substance use disorder. And this is a very different framework than I'm going to present to you because those criteria are more for professional purposes, for insurance purposes, for medical purposes, so we know how to detox people if need be, etc., etc. Tolerance and withdrawal are part of addiction, but they do not make an addiction. So it's important to keep in mind that, the DSM-5 diagnosis of a substance use disorder is not necessarily standing in place of addiction. You can have 4 symptoms of a DSM-5 substance use disorder and also have the pathological brain disease of addiction. You can have 6 and also have the pathological brain disease of addiction. You can be in early recovery and only have 2 symptoms and meet the criteria for substance use disorder mild. So the number of symptoms doesn't necessarily matter for this psychological and behavioral paradigm I'm about to present to you, okay? But I will present some of the symptoms here when I talk about examples. So what is substance use? Again, the paradigm is substance use, abuse, and addiction. So substance use, simply put, is minimal and mostly unproblematic use of substances without tolerance or withdrawal or compulsive use behavior. So all that means is it's a person who occasionally, in no particularly patterned way, uses a substance, having minimal to no negative consequences, no tolerance, which means you need more of it to get the same high, and no withdrawal, which is a specific physiological syndrome when you don't have the substance after tolerance develops. And there's no compulsive use. There's no subjective sense of I have to or I won't be okay. So that's substance use. Most people in the United States and in other countries, Western countries in particular, are substance users. They have used a substance in the last calendar year. Over 50%, I think, have used alcohol in the past year, according to SAMHSA in this country. And nicotine and cannabis I'm not familiar with, but it's in the 30s or 20%, I believe. So there's a lot of people in the United States and in other countries who have used substances in the last year. That doesn't necessarily mean they all have a substance use disorder or that they're substance abusers. So we need to differentiate substance use from substance abuse. And substance abuse, for me, is a spectrum. So substance use is more of a black and white thing. You're using or you're not. Substance abuse is the misuse, as in beyond their intended purpose or how they can function for you effectively, adaptively. It's the misuse of substances, despite negative consequences, of either mild intensity with no tolerance or withdrawal or compulsive use, or with moderate to severe intensity. This would be DSM-5, mild, moderate, 4 or more symptoms or severe symptoms, which is what we typically refer to as dependence when there's tolerance and withdrawal. So substance abuse is the misuse of substances, just the use of substances despite negative consequences of either a mild or a moderate or severe intensity, typically involving tolerance and withdrawal at that point. And at this point, you are misusing substances with reliable, predictable consequences with a pattern, and despite the fact that there's this pattern of substance use behavior or misuse behavior, there's no emotional or relational investment in the substance use behavior. There's minimal to no denial at this point. There's just tolerance and withdrawal. So we need to deal with the concept of denial, emotional, and relational investment when we talk about addiction. But for substance abuse, it's a spectrum of mild to severe, with either no tolerance or withdrawal, or tolerance and withdrawal and compulsive use behavior at the moderate and severe levels. And it's that simple. So substance abuse is just the misuse of substances despite negative consequences, from mild to severe intensity. Typically, the closer you get to severe, the more tolerance and withdrawal you have. Then we have what's called addiction. So why do I not use the word dependence, right? Well, the problem is dependence is a very weird phenomenon. We're not really dependent when it comes to addiction. Dependence is a very unique phenomenon where you just have this subjective sense of I have to have it. And think about all the other activities in life where you will have that subjective sense. Because we're dependent upon all sorts of things like food, sex, and water, right? We have to have water, we have to have food, we have to have sex, we have to have connection. We have kind of brilliant neural architecture for dependence on relationships, food, sex, and water, etc. These are our primal needs that are moderated by the hypothalamus and the VTA and the nucleus accumbens and all that stuff. So we're especially well designed for dependence on food, sex, water, relationships, etc. We need those things in order to be alive and succeed and thrive. The problem would be is when it comes to substances, there almost is no possible way that we need those things, evolutionarily speaking. So you can be dependent upon, for instance, relationships in order to secure or maintain a mate or friends, to keep the tribe strong, to better foster your young, etc. You might have various adaptations to, let's say, promote and effectively manage dependence upon your relationships. So maybe you have more introversion or extroversion to be a better tribes mate, to be a better romantic partner, etc. And this makes it easier for you as a unique individual to succeed and thrive and adapt to an environment and function and maintain your lineage. The problem with drug use at the addiction level is that that makes no sense. At no point is obsessively, compulsively, and pathologically using drugs increasing one's fitness or one's offspring's fitness. So addiction, therefore, cannot be dependence in that sense because, or it can't be typical dependence in that sense because you literally don't have any evolutionary investment in your substance use behavior, and there's no evolutionary investment in the substances themselves. They're not allowing you to function more effectively. In fact, they're doing the opposite. So for me, to keep the dependence word alive, you could say that addiction is a pathological dependence on intoxication, but the phrasing I like better, based upon the neuroscience, is a pathological relationship to intoxication. If you look at the brain areas that are hijacked, to use one word, or overly sensitive, or miswired, literally, in addiction, you see that the orbital frontal cortex, which is responsible for reward valuing, the VTA-NA pathway, nucleus accumbens pathway, which is responsible for just the initiation and learning and memory related to actions or habits that produce an outcome that's good for one's survival, towards food, towards water, towards relationships, towards sex, whatever it is. Typically, neuroscientists describe this as reward, but I don't like that because it doesn't make sense. It's a reward monitoring, a reward anticipation system, not a get high system. You don't feel high necessarily when that system goes off. The other part of the pathway that's involved and hijacked in addiction is the periaqueductal gray, the PAG. The PAG is highly involved in pain and attachment and reward processing via the activation of mu-opiate receptors. So these parts of the, let's say, relationship pathway, which are hijacked by drugs of abuse when it gets to the point of addiction, literally makes it seem as if the person has a relationship to the substance of abuse. They have habits, they have values, they worry about not having it, etc. Whereas the average person who's a substance user does not worry about not having a bottle of wine in their wine cellar. Or the average person who's a substance abuser doesn't worry if they can get to the bar or not. You know, they probably have this definitive sense that they'll probably make it back to the bar if they want to make it back to the bar. But someone whom we would call an addict has this kind of separation anxiety of not having drugs, etc. They might stock up on drugs. They might, let's say, rob people for drugs, no differently than you might rob someone if you were a homeless person and you had a kid to take care of, right? So there's a pathological relationship to intoxication. That's the best, simplest way of describing what addiction technically is, not substance dependence or substance use or abuse. And the best books on this concept, I would say, are John Daly's book, Adolescent and Young Adult Addiction, and Flores, his book called Addiction as an Attachment Disorder. These are probably the best conceptualizations of addiction, not substance abuse. The behaviorists and the learning theorists and the neuroscientists have the best conceptualizations of substance abuse behavior and dependence. But addiction as a different syndrome, as a kind of a holistic biopsychosocial disease, is different. And what's interesting is once it becomes a pathological relationship to intoxication, then all of a sudden what you see is you see the real life relationships of the person we call an addict start to, let's say, struggle or go by the wayside. I work with a lot of young adults, And what I notice is their relationships with their boyfriends and girlfriends, etc., and family members start to go by the wayside. In fact, they become very contentious and hostile or overly disconnected. So there's one of two kinds of adaptations that happen when you become addicted to a substance, even though that's not the best way of phrasing it. So when addiction develops as a comprehensive biopsychosocial brain disease, what happens is your actual real-life relationships become devalued because you've overvalued, through repeated administration and the hijacking of your VTA, NA, and orbital frontal cortex, etc., the substance of abuse. So, addiction is a biopsychosocial brain disease, which we could call a pathological relationship to intoxication. So there's substance use, substance abuse, and addiction. So substance use is just using a mind-altering substance in such a way to produce an effect that has minimal to no negative consequences and does not lead to tolerance and withdrawal and no other compulsive behavior. Substance abuse, which is a spectrum of behavior from very mild substance use that results in negative consequences in a predictable, repeatable way, versus moderate to severe substance abuse behavior, which could include what we call dependence, where you have tolerance and withdrawal and compulsive behavior, despite moderate to severe negative consequences to self and others. And then we have addiction, which is a biopsychosocial brain disease. There's biologically mostly replicable hijacking of your orbital frontal cortex, VTA, NA pathway, and your periaqueductal gray. These pathways are overly sensitive or underly sensitive in ways that they should not be in addiction, which is different than abuse and different than use. So, those are the three definitions. So when I'm talking in future episodes about substance addiction, when I'm talking about addiction as a comprehensive biopsychosocial brain disease, I'm talking only about the pathological relationship to intoxication, not abuse or a use, because abuse and use need different interventions and different systemic change than addiction. So let's define what family is. And I'm not going to pull from any evidence-based definitions here or systems-based definitions here because it's all useless. Speaking in common parlance is way better. So family can be any group of people who you have close, reciprocal, and evolutionary necessary relationships with. So maybe you have what are called fictive kin because your biological parents were killed in an accident. Maybe you have a mentor who's part of your family. Maybe you have a romantic partner who's part of your family. Or maybe you have a child who's part of your family. It doesn't honestly matter. I see every different iteration of what could be called family in my practice and in my clinical experience. What's important is that the family is involved and that your family is involved if you struggle with substance use disorders. So I can think of 3 different examples right off the top of my head of different family iterations. I have one client who is an older male who has struggled with alcohol use disorder for a long, long time and definitely would be called an addict if you were to use that label. And he has ex-wives, multiple ex-wives. He has a current girlfriend. He has multiple children from each ex-wife. And that's his family. And they all need different types of involvement to help him recover effectively. I have another client who's a young girl, young adult girl who has only her grandmother and grandfather and a slightly unsupportive boyfriend at the time. And that's her family. And she needs different, let's say, interventions and different support from those different types of people. And she might even need to add to her family. Maybe her sponsor in recovery could be her family. I have another patient who's an adolescent young man, and he has divorced parents, and he has a brother who's also in recovery, and they also struggle with different issues psychologically and systemically in terms of boundaries and communication, and they have different needs than the other 2 patients I've mentioned to you so far. Regardless of what the family composition, there's always a system involved in addiction, and the system always gets hijacked and becomes wonky in addiction. So when I talk about the etiology of addiction in the next episode, there will be an entire section on how family systems play a role in the development of addiction. And that's not to blame parents or blame siblings or blame friends or whatever. It's just to say that the family is important in both the development and in the recovery from addiction. Now, finally, let's discuss what recovery is. So if you go to a 12-step meeting, what you'll find is that you'll talk about, or you'll hear, two different words often used interchangeably, but they're not really interchangeable. You'll hear the phrase clean, and you'll hear the phrase sober used interchangeably. Clean is not the same thing as sober. Abstinence, or being clean, which just means not using a substance, not having been intoxicated, or engaging in the behavior that is addictive, right? So abstinence is not the same thing as being sober. If you read the big book in the 12-step world, it's even differentiating there the difference between kind of chemical sobriety and psychological sobriety. And what I would be curious about for anyone who has the compulsive brain disease, the biopsychosocial brain disease of the pathological relationship to intoxication, which we call addiction, is sobriety, not abstinence. Abstinence can be extremely helpful and is a bare minimum for someone with addiction. However, abstinence can be helpful and harmful to people in addiction as well, depending upon how it's employed and how it's reinforced and how it's punished, etc. So we have to talk about that when we talk about that in future episodes 4, 5, and 6. So abstinence is just the absence of a substance, not using the substance, not acting out in a compulsive behavior. That's all it is. Whereas sobriety is a shifting of three things. It's a shifting of mindset, it's a shifting of behavior, and it's a redevelopment of a lifestyle that promotes non-pathological relationships to intoxicating experiences. So let me break that down. So simply put, it's not just abstinence. It's also the experience of developing new mindsets, new attitudes towards different relationships, towards different psychological phenomenon. It's a mind change. Secondarily, it's also straight up abstinence, not using substances because they kind of hijack the brain, etc. But sobriety is also this comprehensive biopsychosocial lifestyle change where you're more rewarded and not overly rewarded by different lifestyle activities. So whereas once upon a time in an active state of addiction, you might have had compulsive sexual behavior in the same way that you used alcohol or heroin, in sobriety, you do not have compulsive sexual behavior because you're not trying to manage emotional states and affective states, separation anxiety states, etc., with that sexual behavior, right? So we need to have a brand new lifestyle and as well as a brand new attitude. So if in an addiction mindset, you had this amotivated, asocial lifestyle, in a sobriety mindset, you have a more appropriately social lifestyle. You have better connections with people as opposed to fewer connections with people. If you are more manipulative, so to speak, not to pathologize anyone, but if you used more manipulative behavior to maintain your addictive mindset and your pathological relationship to intoxication, your goal is to use less manipulative behavior in order to maintain your relationships and your needs, get your psychological and biological needs met. So it's a lifestyle change, it's a mindset change, and it's also abstinence. Highly recommend abstinence for anyone with the pathological brain disease of addiction. I always get the question from patients, well, I wasn't addicted, in quotes, to alcohol. I just had a problem with heroin and weed and benzos. My first recommendation is you're welcome to give it a try, but the odds are not in your favor if you go back to trying to drink like a normie, especially if you have not let your brain heal, which I'll talk about in the etiology section and the recovery section, which is weeks 2 and weeks 5, I believe. So you want to make sure that you're very clear when you're talking to your loved one, if they happen to struggle with a substance use disorder, about your expectations about their being clean versus being sober. Because They're not the same thing. Anyone cannot use a drug for a day. It may be very difficult. You may have to white knuckle it like you're going to die, but anyone cannot use. That's not the same thing as being emotionally sober. So I want to talk about these concepts more in future videos, especially when I talk about the etiology. But for now, I'm going to stop right there. I hope that this introductory video has been some version of helpful, and I really look forward to having more discussions with you in the comments and on Twitter, etc. Please follow me at Lockwood, tweet at me, DM me, comment on my YouTube channel. Please like, share, and subscribe. Get my book, The Fear Problem. We will talk about all this more in the next episode. And the next episode is, again, as a reminder, the etiology of addiction in plain English. So thank you for coming out and listening to the first episode here of the Family Addiction and Recovery series, the FAR, the FAR series. And I will be talking to you again very soon in my next episode about the etiology of addiction. I hope you have a great day, and I hope you're well. Have a good day. Bye.